So we had some disappointing news recently about our hospital. CQC has just released its inspection from the whole of the Sussex University Hospitals Trust, which includes Worthing and St Richard's and Brighton. And we've always been used to Worthing being an outstanding hospital, and frankly it still is, particularly the level of dedication and care by the staff there. But overall it's been downgraded to requires improvement. Now, in many ways that's not surprising, because the last inspection was back in 2017, before COVID, and many hospital trusts which are now being inspected because of the impact of COVID, the huge catch-up pressures and the pressure on the NHS generally, are going to see some inspections uncovering some shortcomings. But there were also some really good things that the inspector said. I just want to refer to those rather than just all the negative headlines. The inspector said that we saw some exceptionally caring staff going above and beyond to make sure people have positive experiences during their time in hospital. No surprise there. Staff worked well together, treated people with compassion and kindness, respected their privacy and dignity, took account of their individual needs and helped them understand their conditions. And there are lots of other good points that come out of that. And I've had meetings with the hospital management already, and there's a really strong plan to make sure we get back to good or hopefully outstanding again. But as I say, I want to pay tribute to all the staff, because it's not their fault with all the pressures we've got on the health service at the moment, and they are doing a fantastic job. But there are some really good bits of news as well. And recently I came to the opening behind me of the new Community Diagnostic Centre at Southlands Hospital, one of 160 CDCs being rolled out across the country by the end of March, a year earlier than planned. This actually opened last October, and it's already seen more than 14,000 people coming here for MRI scans, CAT scans, walk-in x-rays, and there's a phase 2 which is coming in later this year as well, where there'll be more treatments here for scanning mothers who are pregnant and so on. Really good success story, going to take some of the pressure off the hospitals and speed up some of those diagnoses. We've also had the recent launch of Pharmacy First. I've done a separate video on that in Green's Pharmacy in Shoreham. This is all about allowing pharmacies at last, should have happened ages ago. You can go to them for private consultations on 7 minor ailments, which they can diagnose and give you drugs or whatever you need. 10,000 pharmacies across the country have signed up to that. The one in Shoreham, we've already seen loads of people in just the first few days. That has the potential to take 10 million appointments away from GPs, again taking pressure off the health service. You'll still need to see a GP for many things, but there's some things you don't actually need to see a GP for. And the other thing that I know has caused a lot of problems has been the state of the NHS dental service. There's a new plan that was announced by the government recently, a dentist recovery plan, faster, simpler, fairer it's called. There's an additional 2.5 million NHS dentist appointments going to be made available. Golden hellos to get more dentists into the profession. There's a load more dental training places, up by 40%. They're visiting vans in hard-to-reach areas doing mobile dentistry, and a real emphasis as well on prevention, working in schools and family hubs to make sure kids are looking after their teeth, cleaning their teeth properly, so they don't have to end up going to the dentist with bad teeth. So big pressures on the NHS, we know that. It's not just in the UK, it's all those countries affected by COVID. Disappointing news on our hospital rating, but they're already working hard to make sure they're on the upward trend again. But really good news on pharmacies, really good news on dentists, and really good news on this Community Diagnostic Centre behind me.